Today, I don't know, is anybody aware of anybody that might be in transit that we should be way to communicate?
You got a couple people. One. I wouldn't wait.
I mean, did y'all see some folks downstairs or anything like that? Well, we'll go ahead and get started, and we can catch up to anybody that comes in late. So this is in regards to the draft hardship guidelines for House Bill 888 from the 2018 General Assembly session. Sincerely appreciate Patrick setting this meeting up for us on short notice, and really appreciate your help in getting this all squared away so we can come and talk about this and kind of share where we're at with the draft. As far as background, I think everybody here knows the detailed background on privatization and where we started and how we got to House Bill 888. So I'll skip that part and just get into the basic background on the hardship guideline, which is in House Bill 888, which is the transition of services for on-site sewage system and private well evaluation and design. It requires VDH to establish by July 1st of next year a set of hardship guidelines that would maintain VDH as a provider of last resort. In addition to the hardship guidelines, there's also means testing, which is two separate things. We'll talk a little bit more about that in a minute. And so this is dealing with evaluations and designs that are associated with building permit or for a failing system for principal place of residence. And the bill states that the guidelines have to consider three specific items, and that is availability of properly licensed service providers, disciplinary history of service providers, and the cost of private sector services. So that's a very quick background on the requirements in the bill for the guidelines. Just to kind of give some background, because we're going to get into some numbers and looking at how the guidelines play out based on data that we have. If you look at fiscal year 2018 data, so that's July 1st of 2017 to June 30th of 2018, we had a total of 252 private OSEs and PEs that submitted at least one application throughout the state. And that they totaled 8,200 designs, a little over 8,200 designs. So if you look at that, that's about an average of 32, 33 designs per AOCP. But certainly it's not distributed evenly amongst the private sector. And then as far as BEAR applications, we have about 71, close to 7,200 BEAR applications. So it was over 50% of the designs were being submitted with private sector work. And this is including new construction, repairs, certification letters, voluntary upgrades. So if you look at transitioning those BEAR application designs to the private sector, it's about an 88% increase in workload for the entire transition. But as with all of this information, it's not evenly distributed throughout the state. There's some areas where there's very little BEAR applications left to transition, and others where there's quite a bit. A couple of things that I did find interesting. So we had 252 OSEs, PEs that submitted at least one design. But if you look at where the majority of that work was coming from, you had 105 OSEs and PEs that did 90% of that work. And their average, so if you look at the average of those OSEs and PEs, it was about 70 designs per OSE or PE. And goes all the way up to the point of, if you look at the top 29 OSEs, PEs by the number of applications submitted, it was equal to 50% of the work, so 50% of the designs. And so we had a really broad range. I mean, there's OSEs and PEs that did, several hundred designs, and then there's a lot of people that did just one. And there was 146 OSEs and PEs that did less than 20 designs. So just sharing that it's the distribution is pretty wide on the amount of work being done by the private sector. I will caveat, this data excludes Loudoun and Fairfax, because I didn't have that data for Fairfax and Loudoun. We have the permit numbers for Loudoun, but it shows them all as being bare applications, and that's not the case. So, we will work with y'all as we move forward and get that appropriate numbers for y'all. So in terms of the hardship guidelines, the means testing, so we had to have a first draft of the policy November 1st of 2018, and had to post that on our website. So that's on the news of interest page. If you look on the agenda, there's a link to a survey, or maybe to the website. And so we have a red cap survey where people can submit comments. We had, I think, 6 comments the last time I looked at that. So definitely encourage people to submit comments via that. I've also gotten a number of emails. Our goal is to take the comments that we receive and feedback that we get. So we had a meeting last week in Three Rivers Health District, had a meeting yesterday in Russell County. We also had a SHADAC meeting last Wednesday, and then also the meeting today, and kind of take the feedback that we get from those, make edits to the hardship guideline, and then post a second draft on hopefully January 4th, at least that early part of January. With that, there was a bill in the General Assembly last year that requires state agencies starting January 1st of next year to post any guidance documents or policies on town hall, just as you would a regulation with a public comment period. I believe it's a 30-day public comment period. So when we post the next draft of the guidelines, it will be up on town hall, and it'll have that public comment period with it, just like a regulation would typically have. And then our goal is, after we have that second draft posted, taking that next round of comments, again making any additional edits, and then putting the final draft out in March, April timeframe, because again, we'd have to have that public comment period so that we had that in place for the July 1st, 2019 deadline for this transition. So I think it's important to start with what's excluded from the means testing in the hardship guidelines. So July 1st of 2018, there were a couple of services that were transitioned to the private sector: voluntary upgrades, certification letters, subdivision evaluations had already transitioned, but it was codified there. And then new on-site sewer systems that are not for a principal place of residence. And so those are excluded from the hardship guidelines and excluded from the needs testing. Those are things that have transitioned and will continue on. And then other items that we're putting in as exclusions are things that by policy, VDH has said that we don't provide primarily engineered services, so non-residential on-site systems, anything that requires a P greater than 1,000 gallons per day, et cetera. And then also alternative on-site sewage systems, which we haven't designed. So those are excluded from the discussion that we're getting ready to have. So as we were drafting the hardship guidelines, we're looking at coming up with the hardships and addressing what was in the bill. And we had initially thought about having a separate policy regarding the means testing because it is separate from the hardship guidelines. But it just kind of made sense to mesh the two together and have all of that in one place. And the reason for that primarily is another important part of this transition is a petition for services. So July 1st of 2019, if a homeowner comes in with just an application and no petition, then they would be expected to provide private sector evaluation and design work with that. So it's not just the application, it's also the petition for services. And then on that petition, they would be walking through what qualification are they saying that they meet? Are they saying they meet a means testing requirement, or are they saying that they meet a hardship requirement? And then if it's mean testing, then we would go through that process. If it's hardship, then we flow through that process. With the means testing, so it was very specific language in the bill dealing with this. The July 1st, 2019 to June 30th, 2020, anyone at 400% of federal poverty level or below would be able to get BDH services. And then that drops by 100% for each of the next 4 years until July 1st of 2023, when the means testing goes away. And so in terms of what that means in income levels, so for a family of four, that's $100,000 a year at 400%, $75,000 at 300%, $50,000 200%, and then $25,000 100%. And so again, the kind of the concept within the policy is a property owner seeking mediate services would kind of walk through the different steps in there. So they would start with the needs testing. Do they meet the needs testing? Is that what the first qualification is? If the answer is yes, they would check that box. And then we would be looking at doing an eligibility determination, just like we would for a fee waiver. If it's not income eligibility, if they're above July 1st of next year, they're above 400% of federal poverty guidelines, then it steps into the hardship guidelines. And is there some hardship that they're meeting? And again, each of those is kind of intended to build on the other of kind of gradually progressing through and checking which one applies. So again, with the means testing, that July 1st, 2023 is no longer there. And so one thing that we have proposed as part of the hardship aspect is an ongoing income eligibility. And that would be tied with owners that are eligible for a fee waiver. So any owner that could receive a fee waiver under the regulations would be eligible as a hardship. And for new construction, that's 100% of federal poverty guidelines. So when we first talked with the Sewage Handling Disposal Advisory Committee about this, we noted that 400%, well, that's greater than 100. You don't really have to make this statement in the draft policy that we have. But we felt it was important to put it out there for public comment, what we're thinking, what we're proposing. Even though anybody that would qualify for that would qualify for the means testing for the first 4 years. In addition to that, and we'll talk about some new fees here in a little bit, owners with income below 200% of the federal poverty guideline for repairs would also be eligible, because with the new fees, the waiver for repairs is set at $200,000 versus $100,000. And then again, we're proposing that the determination for eligibility would follow along with this same procedure that we have for fee waivers. But that being said, George and Patrick, you might have seen this from the Commissioner's office. They had an eligibility policy that I guess they use for WIC clinics and all the different services that's out. It's being put out, I guess, for revision. And so we're going to talk with them and see whether it would be appropriate, to follow that, which is essentially with the fee regulations ties back to, if you look through the policies, but making sure that there was not. And essentially what that means, someone's gonna have to come in with a W-2 or with, some proof of income.
Lance, what is the fee waiver? I don't have that regulation handy. What is, are you gonna go over that, like, for them to qualify for the owner eligible to receive a fee waiver? What is that?
So currently in the fee regulations, so this 12 Act 5, 62088, if a homeowner is at 100% of poverty guideline or below, they can waive the fee for new construction. So if someone were doing new construction and they were at that income level, they could waive our application for 425 or 225. With repairs, we'll need to do an exempt action to the fee regulations to insert those fees and that fee waiver in order to have that in the regulations, but it's in the code or in the budget as it stands right now. And so anyone that, what we're proposing is anyone that could get that fee waiver would also be eligible for a hardship to get
So they may have to meet at least 100%.
for new construction. But again, this is an ongoing, so this really, for the new construction, wouldn't come into play until July 1st, 2023. Because up until that point, the means testing is getting you up to 100%. Following along with that aspect of people being eligible for fee waivers, we're also proposing that replacement wells and well abandonments, and anyone seeking those services would be able to qualify for a hardship, because within the fee regulations, the fees are also waived for those. It's a little bit different because it's a May. It's basically set up where the local health department has some flexibility. They can either charge the fee up front for a replacement well and then refund it once the well has been abandoned, the well that is being replaced is abandoned, or they can just waive the fee right off the bat up front and give some flexibility to the health department. But ultimately, it does result in a fee waiver.
So that's only if they still have to meet the income?
No, so, and that's a great question. So again, within the fee, or within the petition for services and looking at the hardship guidelines, so they would start with means testing. Do I meet the means testing requirements? So July 1st, 2019, I'm a homeowner and I'm seeking whatever service, and I'm at 400% federal poverty guideline or below. They check that box and then provide that proof of income, and they would be eligible for mediated services. Someone that's above 400% of federal poverty guidelines, they're not going to be eligible based on the means testing, but they could be eligible on the hardships that we're proposing. And so one of those being a replacement well. So somebody could be above 400% of federal poverty guideline. It's a replacement well, they would be able to qualify. And then you get down to July 1st, 2022, when you're at 100% of federal poverty guideline for means testing. Anyone above that would be, if it's a replacement well, they'd be using the hardship versus the means testing. Does that clarify things? Hopefully. So the next piece is one of them that we had a lot of feedback on, a lot of conversation on. And that's dealing with the number of private sector service providers. So we're proposing, and this gets to part of the aspect of availability. We're proposing looking at an equation and running that statewide to come up with areas that we believe have a sufficient number of service providers to meet the need. And so what we're proposing is looking at first the number of private sector service providers that have provided at least 5 designs within a locality over the previous fiscal year. So if you look there, there's a lot of counties where you may have you people come in and they submit one or two designs, but then there's 3 or 4 that submit 10 or 20 each. And so looking at just the ones submitting that 5 or more, and part of it gets to the next part, which is the average number of evaluation and designs by those service providers. So if you include in the ones that are just doing one design, and maybe they only did one in the whole district or the whole region, and that does bring the average number down. But rather than looking at the average on a locality basis, because some localities we have a handful of private sector designs, looking at how many that AOC submitted on a regional basis, and that's using this map here. And I've gotten some feedback on why are we using this map, this region-based map. So if you go back to 2011, we had an RD32 report to the General Assembly that used this map in collecting data, and then we used that same map when we were collecting data for House Bill 558. And so for consistency between those different reports and moving forward, we use that same regional-based map. So you would look at the number of private sector designers, the average number they're doing, you come up with some number of designs, and then had a growth factor, so we're proposing 25% on this first go round. So you would have, they're doing 100 designs, you get 5 designers, they average 20 each, they do 125% growth factor, you've got 125 designs that we feel like is how many the private sector could potentially do. Then taking out how many the private sector is currently doing within that locality, and then comparing that final number to the number of bear applications. So the number you're getting is the number of additional designs we estimate the private sector could do, and then looking at that number versus the number of bear applications. And if that number is higher than the number of bear applications in a locality, then that locality would not qualify for a hardship of insufficient number of service providers. If the number is smaller than the number of bear applications, then they could use that as a hardship. And I'll talk a little bit later. We've had a lot of feedback and comments on different ways to look at this, and we'll run through some of those different maps if you change the growth factor and things like that. So some caveats to all this is, one, we're looking at if a locality only has one designer that's done at least 5 designs, then we would say that's insufficient number. One of the things that we got a significant amount of feedback on was there needs to be choice, and so we need at least 2, so there is options there. And then another caveat is for localities that get 10 or fewer applications a year, so Alexandria would be an example of that, that those would just transition automatically because it's so few, even if you had BDH doing that, it's not a lot of work. In a lot of cases, Richmond City, that's getting formed out of districts. One thing that I should mention before I get into the map, so we're also proposing to separate out on-site sewage system services and private well services for these 2 maps. So if, we talked about the number of designs for on-site sewage systems, it's over 50% private sector work. If you look at the well information, it's under 40%. It's in the upper 30s. And so if you combine those two together, then you would have some areas where there's a lot of private sector work on-site work, but the wells could potentially, make it seem like it's a hardship when there's a lot of private sector participation in the on-site work. So we're proposing to have those two separated out. So if you look at the equation that we have drafted and looking at FY 2018 data, this is how the map would lay out. Again, it's locality-based rather than district-based, and I'll talk about that in a little bit. So you'll see like Three Rivers Health District, they have 2 counties out of the 10 that would still be able to qualify as a hardship for the on-site part. And then there's also Charles City County is kind of an outlier for Chickahominy Health District. You have Rappahannock, Page County. One thing to note about this, though, is we're using FY18 data. When we do the final guidelines, we would be using FY19 data. And so this could change a little bit. In Charles City, Page, Rappahannock, they were all very close to that threshold, so it's possible that they would go over that trigger and they would come off the map. So that's the first part of availability. Another part dealing with availability that we got significant feedback on. So I went and met with some county officials in the eastern part of the state and in Southwest Virginia, and just general feedback that we've heard going through this process is there's a lot of concern about timeliness of service and making sure that people can receive services in a timely fashion.
Lance,
Yes.
what type of service are they expecting to receive?
So, and this brings up a good point from the Shade Act the other day. So, in here, we're talking about availability, and we're proposing that if the private sector is not available for new construction within 15 days, repairs within 5 days, that they could qualify for hardship.
Well, I mean, do they need, you have to be on the site within 15 days, or you have to have the package done in 15 days?
Right, and so the Shade Act recommended, they said, well, you really need to define what availability means. Are you talking about, and what, at least conceptually, we were thinking about was that first site visit. Because sometimes, it's not just one visit, it's multiple visits. And the other qualifier to that is that the property is ready for a visit, because you have to have the property surveyed. Is it ready? Or is it in a state where if VDH went out, it would be kind of what we used to call an administrative denial, because it's not marked, it's not ready to be evaluated. So there were some suggestions that we need to clarify and define what we're talking about is in terms of that availability. It wasn't intended to be you would get the design package back in 15 days. The intent was that.
So in other words, someone just has, in that district, has to agree to go out within the 15 days.
Right. That
And if they can't find anyone to just at least show up, then you would fall into the hardship stuff.
Correct. That was the intent. And so there was a good suggestion that we definitely need to clarify that.
So Lance, would it be up to us, so they come to us and they say, hey, I can't get nobody to show up in 15 days. How do we validate that, or do we just take the word for it?
And so there was a lot of discussion on this section at the Shade Act meeting. There was a lot of different suggestions because there's concerns. So we proposed, they give us 2 names of contractors. It's a state form, and we would take that word, because otherwise it'd be lying on the state form.
What was that, Lance? I didn't hear that.
I said we would take their word for the 2 names that they provide, because otherwise we'd be lying on a state form. If you said, hey, I called these people and they said they wouldn't come out in 15 days.
So if they, if they just apply, you know, say Bob's name on an application and mine for giggles, and then we come to find out that we were never contacted, what do you do then?
And so that got to, there was also some feedback of, well, what about a locality that has 10 AOSEs? What if they call 8 of them, and 8 of them say, I'll be there in 15 days, but the 2 they put down are the 2 that said, I won't come out in 15 days. So there were people that were willing, but the 2 they tell us about were the 2 that weren't.
Are there consequences for that is my question.
And so that gets to some of the edits that were being suggested was, rather than putting the onus on the homeowner, you know, should it be more of a conversation between VDH and the private sector and having, you know, and I'm sorry if I butchered this suggestion. So there was one suggestion from a SHADE Act member of having VDH reach out, the local health departments reach out to the private sector that are working within their district, either on an annual basis, or monthly basis, and saying, you know, what's your backlog? Are you available within 15 days? And they have 3 AOSEs that say, yeah, sure, I'm available in 15 days. And so if somebody comes in and checks that box, they would say, well, we've checked with the private sector and there's 3 of them that say they are available.
They may say they're not available just because they don't like the price too. That could be an issue too that would come up.
So that was a concern that they had been raised.
And then one thing too would be indirectly we would be recommending someone. You know, let's say only one AOC is available, and someone comes and says no, then we would say yes. I mean, asking who.
Is it really an expectation for that homeowner to have to call everybody to make sure that there was somebody? Or have they done their due diligence by calling at least 2 and gotten the answer that they need to get?
I'm sorry, what was that back?
No, I'm saying, do you really expect a homeowner to have to call everybody that's doing work in their district? Or has a homeowner done their due diligence by calling 2 people, gotten an answer that I can't get there in 15 days, they go to the next step and come to the health department, versus do you really expect them to have to call everybody that does business in their county?
And so what was proposed would be just the 2, you call it, it's 2. But some of the suggestions we got from the SHADE Act was they should have to call everyone that's done work in that district. So there are a lot of different ideas that are being, you know, thrown our way of how we could improve this section. And so I appreciate any.
I think it's putting the health department in a bad position then to try and go out and verify this, you know, and then it becomes their word against their word. I did call the person, they said they weren't available, or yes, they could come out for a site visit, but they really couldn't start the job for 2 more weeks past that. You know, at what point, to me, it gets to become a muddy area. For the health department to be involved in it, to me, it should become more rigid. If they let an application and maybe somebody felt that they were disenfranchised by that homeowner's opinion, maybe that's an issue they can take up with that outside the health department. I just hate to see the health department become now a referee in
Totally agree.
outside of what our role really is.
Can the homeowner, I mean, think about homeowners and, you know, so many times like with a repair, you know, you have Grandma Betty who's needing a repair and she's needing, you know, she meets the means, or maybe not quite, but it's a hardship. And so now she, who has a hard time looking through a yellow page book that doesn't exist anymore, you know, trying to find every single person that can help, and she's someone like, nope, can't get out there, nope. But then, you know, do they put it in writing that they don't have that time to do it, and she has to show that, or, I mean, there's,
So, and that gets to one of the things that we're looking at is updating our service provider website. So, I'll be honest, the service provider website has been limited to my ability of what I can do within Google Fusion Table, and I haven't been able to find a way to put that point, you know, where the person's located, and then also show graphically what area they covered. And so one thing that we're looking at is taking that and turning it from a map to just maybe a drop-down list where Jim or Bob, you would submit your name, and just tell us, these are the counties that I'm willing to work in. And then when the homeowner goes in, they select the county, and then it gives them a list of.
Wouldn't it be easier to say, maybe these are the counties I don't work in? It just depends on where you work. These are state licenses. So the concept that you only work in a municipality seems somewhat narrow-minded. I'm sure there's people that's willing to work in the entire state.
Right.
But if you can't get opportunity to do it, it's foolish to say, I'm only going to work in these 2 counties, when sure, you would love to work down in Southwest Virginia. But if you're doing 98% of the applications, I don't think anyone's going to drive down to take a chance of not getting anything.
In terms of getting on the website, so one of the concerns that's been raised is with the map that we have now, if you zoom in too close to the county that you're in, you might not see people, or maybe you're looking at, here's the person closest to me, even though the next person over is just.
I mean, again, a simple but old solution. I mean, there were a time years ago where we just had local databases. We had local lists of who were on there.
Right.
That doesn't seem to be too unbearable. I mean, I don't think Loudon still has theirs. I'm not sure, but I know Fauquier does.
And so the idea with this different way of doing it was, then we could take that list on the website and make it into, a list that could be provided at the front desk.
If the locality has a list and you're willing to be on that list, it seems to cut one of the steps out that you have to worry about providing. You refer them to that county, here's everyone that's on the list. If you're not on the list, obviously you're not interested in working there. I mean, I don't camp at a campground where I don't want to stay, so why make the reservation?
The only other thing I would add about the list, because I came across this recently, is there's got to be a mechanism for people to come off the list with the website, because I know I found somebody that passed away years ago that was still on the list. But I guess with the administrative list, there was no real mechanism for them
They keep that
to be maybe annually confirmed or reassessed, or if they dropped off and people or licenses lapsed, should they still be on the list?
And that was a suggestion from the chair, was that, and we'll talk about the annual review, just in the hardship guidelines, that was a suggestion, that should be part of that is. So again, this piece is something that we've gotten a lot of feedback on, a lot of different suggestions on, and again, be happy to hear the thoughts you have on how to improve this. There's been comments from some people that 15 and 5 is too long. If it's failing, somebody should be out there right away. And then certainly gotten feedback that 15 days is not adequate. You need more time. And I think a lot of that gets to the expectation of what availability means, what the expectation is for what service would be provided under that. So I think starting with defining what exactly we're talking about.
Lance, they just seem to be 2 different worlds here. I mean, one's an actual health threat, the other's a potentially perceived threat. Who cares about a perceived threat? It doesn't exist. Yeah, bring that back up, please.
I'm sorry, I'm flipping between making notes.
Well, the whole idea of the 5 days, I mean, I get the merit behind it. But what is it going to accomplish if you do get out there and you find out maybe you do have to go on pump and haul? And you're the homeowner, and I say, well, Mr. Greger, you have sewage on the ground, let's get it off right now. Call a pump. And you're going to question me as trying to run a racket. Next thing you know, you're calling the local health department. If they don't get out there and, work with us and follow up that it gets done, we're wasting more time. So there needs to be some connectivity here. Some understanding that when we get there, yes, you got to figure out what the problem is, but until you're able to get that problem resolved, you need to get the sewage off the ground. And we don't always see that. And again, that effort, I think, comes from your office. Those letters have to come out. And that's the only thing that forces that homeowner to get that sewage off the ground. Then we have time to think and figure out the best solution.
But I don't think this leaves the health department from coming out and doing a complaint investigation or issuing that notice of violation. It's just, we're not doing the design and evaluation for the replacement or repair of that system.
Right, so if you had, and that was a question that I got, so if someone calls in with a complaint and says, hey, my neighbor's sewage system is failing, it wouldn't be, hey, they've got to go get proper safety. So we go out and verify that it's failing, it is failing, issue an NOAB, and part of that would be you need to apply for a repair permit, and then it's up to the owner, if they want to submit and request means testing or hardship, if they're just going to do it right.
Actually, I did have a similar question. When I talked about in the House Bill 888, that said we would cease providing design and evaluation. I think a lot of people immediately go to design and evaluation for a site for a new system. But I know we've had this discussion that you're interpreting evaluation to also mean evaluating an existing system. So how does that impact us, our ability to go out and assess or evaluate an existing system during a complaint? We prohibited from that, or are we still allowed to do that kind of evaluation but not?
So evaluation and design in regards to seeking a construction permit or seeking a safe, adequate, and proper approval, but regulatory enforcement inspection, going out, is there sewage on the ground, getting to Jim's point, does this site need an NOAB to get them to go on pump and haul? There's still something that or it's still something that
Does that apply to the annual inspection the health department does for discharging systems? Is that?
right, because that's
not an
that's a
evaluation.
regulatory inspection requirement that we have. We go out, but then in the interim, the owner is supposed to have a licensed individual coming out and giving the operation.
Doing their formal and informal reports, but we can still do the annual inspection.
Because the House Bill itself doesn't really clearly define that. It just says cease providing design and evaluation services.
I'm sorry, taking notes.
And I know, just to piggyback on that, since you're making the notes, we had this discussion before, but it also carries them into those things from other state agencies where like social services and the Department of Mental Health, when they want us to come out and evaluate an system for an existing house because it's going to be a group home or something like that. I think there's still the expectation that we would still provide that evaluation.
Right, because that's an environment, we're going in, we're looking at food preparation and it's
Okay, but the system itself, we, part of the form, we evaluate the system.
right, and so that's in line with what we talked about with the courtesy reviews. So safe, adequate, and proper, it's really two different things. A lot of times we lump everything under safe, adequate, and proper. But safe, adequate, and proper is really just things required under 32.165, which is building for human occupancy.
But again, that's not clear in the House Bill 888. It doesn't delineate that. And the reason I'm bringing up the part of this is because of the hardship guidelines, would there need to be a mechanism in the hardship guidelines to still provide this service of the hardship, or is it not needed because it's clear enough either by policy that we can still continue to do those things absent a hardship?
And so while we're talking about SAPs and some of this, one thing that I mentioned to the Sewage Handling Advisory Committee was we don't have good statewide data on safe, adequate, and proper evaluations. We have our database that we're transitioning to, so Ed, we're going to have, improved reporting in that for safe, adequate, and proper. I'm sure Fairfax and Loudon, y'all can probably give us very accurate numbers, but it's each individual locality database and trying to compile that. And then not every locality has an electronic database for that. And so one thing that we threw out is what would be the thought with VDH continuing SAP evaluations as a hardship for a year while we collect data and get a better handle on how much of that work is currently being done by the private sector versus VDH. Because it's really hard to tell from the limited data that we have.
So I know we've had discussions about this, but do you know, I can make for the benefit of the others, do you anticipate, I guess, things that we discussed not happening or changing as far as the health board continuing on to do business the way we've been doing it, where there's things about uncovering components and, you know, the age of the system and, you know, being a fairly new house or having maintenance records, being exempt from the, you know, requirement to have a third party go out and uncover components.
Right. And so and we've had some discussion about, you know, with the SAPs, if you look at the policy, we talk about if it's an alternative system that had maintenance within the last 12 months, then you assume that system functioned properly and you can check that as SAP without an evaluation. There's some other caveats. And so we do want to have a conversation about are there other caveats, situations where maybe a site visit isn't necessary for an SAP request, where you wouldn't need an evaluation. You built the house 6 weeks ago, got the OP, and then went and got a building permit to add something else on it, kind of last minute addition or something like that. Where the system is functioning, you have good records.
Well, if it involves a license, you're not supposed to be approving anything you don't verify. That's a VDH choice. I don't think you should yoke the license to it, though.
I didn't hear, what about the license?
Don't yoke the license, any license, to a VDH practice. You're setting people in harm's way. So at the end of the day, you make the decision if the license is required to exercise that discretion.
That's not fine, you would say what license being required?
That's what I'm making inference to. If a license is required,
Right.
don't yoke it to it. For example, the wells in the well program. Do you need a license to design a well? Because right now this agency has my OSE license yoked to that well, but you're not authorized to design it. So why would I have an interest in being tied to it if I can't do it?
Why can't you design a well?
That's what my licensing board says.
You know, any thoughts on the SAP part? I appreciate that comment. And again, to the conversation I had previously, the duties you look at, that SAP policy, we need to do some training on the policy we have, you get some feedback from districts on implementation.
I guess what I'm saying, the policy is in place now, it's still, we can still continue to do things because it's associated with the building permit. So, but in 2019, is anything going to change with that? The way it's written in the House bill, it would. If after 2019, even if it's an evaluation associated with the building permit, we're still not supposed to do it.
Right.
Unless it be a hardship item.
Right.
It's a hardship.
Right, so July 1st, 2019, it would have to meet a hardship if it's an SAP,
Right.
an actual SAP under the code.
Right. I guess the debate is then, at what point does it become SAP? Just because it's a building permit for an addition, does the health provider, anyone really needs to do a safe building permit properly, under certain circumstances?
That's-
And there's certain circumstances where I guess things are still to be determined. They're in the GMP now.
Right, we have a GMP, but if there's other things that we need to be considering. Again, like alternative systems is the
Right.
example that I fill out. we say in policy, if it's an alternative system, the VI license, individually submit a report within the last 12 months. The health department can provide that approval to do. So the last piece within the draft guidelines is further consideration. So certainly there's going to be homeowners that are going to have hardships that they feel don't fit within what we lay out. And are going to want to have BDH review that. And so we're proposing to allow owners to petition to the district health director for that further consideration. And then that could be delegated to the district environmental health manager, and then those would be reviewed on a case-by-case basis. In this and all the other aspects of this, an important part of that is an annual review. So it's going back and looking at what types of cases are we having come in that are being granted for hardship, for means testing. Is it people between 300 and 400%? Is it people between 200 and 300%? What are the different levels that we're seeing people submitting those income eligibilities for? Because we don't have that information. We don't ask people when they come in, are you between 300 and 400% of federal poverty guidelines? We don't know how many people are going to qualify for that. But if we have that information next year, then we'll be able to, and we are proposing to add some data fields in Ed, our new database, in order to track that, so that then we can look at better forecasting of, okay, in FY 2020, so July 1st, 2019 to June 30th of 2020, we had 300 people between 301 and 400% of federal poverty guideline that submitted for means testing. So we would know in the next year that's about the percent of applications we would expect that would fall out in that means testing on the jobs. It's also looking at, just in terms of shifting work to the private sector, how much has it actually transitioned between year to year? And so in making sure that we're going in the right direction. So we're proposing to do annual reviews for at least the first, I believe, 5 years, looking at comments from the SHADE Act and stakeholders. So the idea being we'd have a final policy July 1st, 2019, and then that policy would be in place until July 1st, 2020. At what point, prior to that, we'd be working with stakeholders, looking at data, and seeing are there edits or changes we need to make. Looking at, we would reevaluate this map. So the idea being, this is, again, on FY 2018 data, but so let's say this was 2019 data. We run this, and this is the hardship areas for the first year. Then the next year, we would run those numbers again just for the localities that are in red. And the other localities have already transitioned. And then maybe you have 5 or 6 more counties that transition out. And so you have a new map. And then the next year you run it again, and maybe you have more counties fall out. And so you're gradually transitioning those out. And the ones that transition don't get rerun. Once it's transitioned, it's transitioned.
So you're saying nothing would transition in? So if you had providers that went out of business, and so now, you had a void in that area, you wouldn't transition those counties into the hardship?
So what we're proposing is that once a locality is transitioned out, and this is for this particular hardship. So again, you're going down. Do I meet means testing? No. Let's take me for example. I live in Chesterfield County, and so do I meet the means testing? Yes. And then I check that, and then I don't have to go any further. Or do I meet the means testing? No. Well, do I live in a county where it's an adequate number of service providers? Yes, I can't check that hardship. Is it a well replacement or well abandonment? No, I'm trying to get an on-site system, so I can't check that. Go down to availability. Did I call the AOCs and they said they would be out here in sufficient time? Yeah, okay, and I haven't checked the box, and then you're left with the further consideration, what other unique factor would I be
I
trying to?
don't see it ever impacting us, but I do see in here, is if you have a fairly low number of providers, and then all of a sudden, a provider or two goes out of business, you could have an area that's not served anymore by private industry. I guess that's my question, I didn't know.
And so that could be a situation where further consideration comes in. So let's say you need to transition out the Eastern Shore, and then the 4 designers that are out there all go out of business at the same time or something.
At least it's not financially
Right.
viable, it's just that they're not making any money at it. They say, we're not doing work in that county anymore, or that area anymore. It's
Or
not,
they've aged out, and a lot of people aren't doing
So-
this.
or it's not profitable, it's in an area that just, the money's not there. I mean, I don't know, it just seemed weird that it would only go one way but not the other. It seemed like it should flow both ways.
Then it would be availability, like you can have, because then maybe the ones that are there aren't available, but you're calling others and they're available, or again, further consideration if that's the case. So talked about the annual review. So 2 things that I did, I apologize, with the hardship map. So dealing with the consideration of disciplinary actions for licensure. What we're proposed is, and we had some really good edits from the SHADE Act on that section to kind of clarify some of the language, is that any OSD or PE that has a disciplinary action, we would not count towards the totals when we're doing the equation for this. So if you have, let's say, 4 AOSEs in Essex County, and one of them had a disciplinary action, we wouldn't count them in the equation. They still may transition. Where it becomes a more significant factor is if you have a locality that only has 2 AOSEs and that do 5 designs, and one of them, if they have disciplinary action, now you're down to 1, and so that would still be a hardship.
I'm just curious, I don't know if you have the answer. How many people have actually been disciplined since the license was created?
And I don't have the answer to that, but I know it's not, hasn't been a lot.
So the boogeyman's out there, but we couldn't find him yet. I know of like 2. I know of 2 people since the license started.
And that's an important thing, is we're talking about disciplinary action, not complaints, because a complaint could be
Well, I get that.
unfounded.
So what I'm saying is that the program's been in effect since 2009. We're getting ready to come on a decade, and 2 people that I know of had action taken against them. Is that really a foreseeable problem? You said there was, what, 250 some AOSEs in the state that were working? And 2 of them did something they shouldn't have done?
Are you sure 2's the number? I know 2 off the top of my head.
Yeah.
The number will keep growing,
Yeah.
but I, in the grand scheme of things, it's insignificant.
It may be now, but
It's insignificant. We've been at this for 10 years. Some of us have been at it for 20. We just didn't jump on the band once we got the license.
I would argue that some of it's before getting on board with actually feeling comfortable going forward with some of these.
That's true.
I've noticed the very uneasiness from the very beginning, but that uneasiness seems to have been.
And if you're talking about a very large subdivision, multi-million-dollar deal, and one of those is the disciplinary action, I don't think that's feasible.
Who cares what the value of the house is? If
Person
someone who's impoverished got ripped off, it makes no difference if they're rich or not.
But I think the point is, you don't want to force that person, whether they're impoverished or rich, to go to that industry if there's only 1 or 2 providers in that jurisdiction, and force them to use somebody that does have disciplinary action.
And what if you find out that it's the health department that's ripping these people off? Then what do you do?
There should be a mechanism for that as well.
There you go. They're down in Southwest Virginia. You need to waken up and go down and visit these places. You don't go out there and just broadcast the drain field and say, we're giving everything a 65 rate, when there's 200, 240 rate soils everywhere.
They should
And
be
2
licensed
months
individual
in-
well, there should be a mechanism. to
2
do that.
months in, these homeowners who are living in trailers have sewage on the ground. And
Like
now
I
the
said,
person who
they're
issued the
licensed
permit.
professionals, they should be dealt with as equally as
The
any
county,
other.
no,
private
this is a
licensed
fact, this
professional.
happens. The county goes out, they do it. Their licensed professional designs it, it fails, and they're so poor, they're afraid to go back to the man that just issued the permit because they know what's gonna happen. They don't have the money to fix it. This is what we as professionals are trying to stop.
I see the same
Not-
thing with the
not
private
private.
industry doing it, so don't get me on that bandwagon.
Then you have a problem with oversight in your district. Step up the game with oversight.
When it happens within the health districts, people also have the ability to complain to D4. We are licensed, and our career plan does specify that we have to maintain a license. And if our license is revoked for any reason, we are suddenly unemployed. With my understanding, without recourse. So if you guys have a recourse of perhaps getting that licensure and restarting your business or partnering with somebody else, we don't have that same recourse. My retirement goes away.
I think the point just being, if you have somebody that's got disciplinary action, they're not doing a good job, whether it's private or public, you shouldn't be forced to use them. You should have options.
I feel that the same way. And it goes both ways.
But I think that's the point you're trying to make, right, with this one.
Yes.
God, I'm trying to make.
I think the problem is, if there are that many bad people, where's the oversight, where's the administration of the program?
But I don't think Lance is trying to say there's that many bad people. I just think he said if there's relatively few providers and one of them is a bad person, you shouldn't be forced to have to use them.
Well, again, why are they still hanging around? We can't sit here and keep saying
We don't license them,
decoys.
we don't regulate them.
That's correct. It's D4.
If you accept the applications and you witness the
We-
event, you
If
have
they are in
to.
good standing with you, do you think we have the ability to say we're not going to accept your application?
Yeah.
That we can go out and do a level 2 review and deny the site, but doesn't mean we can't refuse to take your application because we don't like them.
So when you're done processing the application, did you file the complaint?
Absolutely.
Yes.
Okay. Did D4 act on it?
Sometimes.
And when they didn't? That means you have to write a better complaint. Just make sure you have it.
That's the thing.
That's not
It's just
necessary.
not working.
So disciplinary action was part of the bill. That's one of the specific things that we had to evaluate. The other one being cost was another specific aspect of the bill. What we're proposing as part of this annual review is that we would survey and get data on average cost of services and provide that information on our website so owners could make informed decisions. We didn't feel that, proposing that as a hardship would be appropriate. If you say, well, if it's above the average and the average is $1,500, then you could have every AOCMP that's charging more than that's going to go at $14,999, and everybody that's below it could come up and be setting prices. That's not what we're trying to do.
Well, that's kind of my question. What are you trying to accomplish with the surveys regarding the cost? Because the prices really haven't ebbed or flowed in about a decade. Might be close to more like 15 years. But we know the average statewide is hovering around $1,200. You already know that. You published it.
Right.
Consultants of the agency published it. It's not rocket science. But I guess, what are you trying to accomplish with it? That's the,
Any of it is making it public knowledge that owners know they can make an informed decision. Here's what the average cost.
so do you tie the failure rates and the repair rates with that system price? Do you tie it to the contractor?
Yeah, so what we're proposing is it would be anonymous.
Well, I get that, but if you're really trying to protect the consumer, let's all get on board and protect it. Don't sit here and say your design price is going to affect the construction price and the quality of the job. It has nothing to do with it.
Lance, would the idea be that BDH would do that survey or districts would do that survey?
So one of the things that we were looking at was potentially putting something in the form letter that goes to owners that would link them to a survey if they wanted to take that. So it would just be a link within their permit letter.
What would be different, let me rephrase. How is that any different than a homeowner just calling 5 people that are on a list and asking for a quote? And them doing due diligence, and the health department has nothing to do with the money. I know for years, when people would ask me the cost of the system, I was supposed to say, I have no idea, even though I see the invoices all the time. I'm not supposed to be involved in the money at all.
Plus, it's so variable depending on the site. I mean, yeah, it's,
Not something we,
all over.
our
Side of the
EHS are
property,
not.
regular district, yeah.
Yes. Because there's so much variance, our EHS won't tell you that.
Right, and the idea here is that local health departments have to not be able to say, well, this is what the average is in Loudoun County. This would be something from the central office, we'd be correlating that data like we did with the House Bill 558 report. Saying here's what the average cost is bigger.
Well, Lance, I think my point there again about the cost, it matured. It matured almost a decade ago. What are we, again, what is the agency hoping to pull out in order to obtain better health outcomes? Worrying about price. If planning and budget were involved, I think I would go along with it, but it doesn't seem like they are. So if we charge more, will that help the agency have better administration of the program? If we charge less, will it help you have better administration?
Again, it's simply looking at allowing owners to make informed decisions. That's strictly what we're looking
So we're only doing that to the designers though, not the operators if it's an alternative, not to the installer if it's any system, conventional or alternative.
Well drillers?
I mean, is the building permit giving them a discount on their application fee?
How about the real estate agent on the commission?
I'm just curious, Lance. Because if most of these designs, if you look at the average, and let's say, I've heard it 100 times at the last Prince William County, the average cost of a system in Prince William is $35,000. So if someone's charging state average $1,200, that's not even 10%. It's not 5% of the construction costs. Is that really going to hurt that client? Or is it when they get ready to pick the contractor and put the system in?
So there's a suggestion to not just collect design costs, but also collect.
If it's going to help you run a better program,
It's going to
Have
have
at
a
it.
public health outcome.
but if it's not improving it, I don't know why are we wasting time? Let's get back on things we can actually accomplish. Because if you don't include the well driller, the realtor, and every professional that's involved,
The lawyer
it
closing.
just seems like you're looking out for your interest and displacing your competitors who, believe it or not, have the same interest. They want to see a client that has a problem, get it resolved, and do it in compliance with the law. It doesn't seem that hard.
Appreciate that.
No worries, Lance, no worries.
So, I mentioned earlier, there's a lot of different suggestions in regards to the equation part. I wanted to save this to the end, just so we kind of see the back to back. So this, again, this is the map based on the equation that we have in the draft policy. And one suggestion, and I guess I should note, so with this, so we said that, go back a little bit here. So we had 7185 bare applications. And so if you look at this transition map, what that equates to is about 3,700 bare applications would be covered in the areas that are not red. So it's potentially transitioning about half of the bare applications with the map as drafted. So one of the suggestions was, well, instead of doing it by locality, why not do it by district? Because you end up with these kind of outlier counties within a district. It would make it more simple for districts to implement if every locality was the same. And so if you do it by district, you can see the map changes pretty significantly. A couple areas that point out. So New River Health District, if you do it on a locality basis, every locality transitions out as having sufficient number of service providers. But if you do it on a district basis, because a lot of those service providers are covering all those same counties, and then your number of their applications is increasing, it becomes a hardship. Three Rivers Health District, you go from having 2 localities that would be able to qualify as a hardship to the whole district.
All right, could we stay at that map right there once?
The district one?
No, not that one, next one.
The
Next one.
locality?
No, not that one. Yeah, that's this one. We go back to that money thing again. If we're going to help people and help the agency get to where they can help more people, why didn't we bring about and pursue the voucher? Now, I mean, we know the last time you were up here, you said you wrote this bill for Bobby to produce or sponsor. Why didn't you include just the voucher system in it? Because if the private sector could do the average cost for $1,200, that's anywhere between 1/2 to 75% cheaper than you can do it.
So
And they'll still get the same outcome.
So I'll just say that's not part of the bill. It's not part of the.
Right, but you wrote the bill. That's what I'm getting at. Why wasn't that on the table?
And so I guess what I'm looking for suggestions on the hardship guidelines that we have based on the bill.
So when you wrote the bill, you didn't think that was viable to save everyone money?
Well, there would be a cost to that.
Well, right, it's going to save everyone money. Because if it takes you 50 to 75% more than any private sector person to do it, no matter what, the legislature, we all win. That means we pay less taxes.
Again, I'm looking for feedback on the bill that we have in front of us, the hardship guidelines that we have in front
My bad.
of us. So I appreciate that. So again, the district basis changes pretty significantly. The other key point to this is, so under the locality-based one, it's about 3,700 applications that would potentially transition. Again, someone could qualify for means assessing or something like that. But under this, you only transition about 2,900. So you actually transition more bare applications using the locality-based than you do with the district-based.
Which method gives the locality the highest order of control?
So the locality basis is looking more at the conditions within that locality.
So VACO will support that one, right?
So it's not so much a locality control, it's it's a difference
Well,
of,
if you have numerous localities in a health district, I don't think each municipality has the same interest.
right. So I mean, it's,
So this map right here will give the municipality the most control over, quote, their interest.
I mean, it looks at the locality-based data rather than a district as a whole, and that's the difference.
Right, but I mean, Floyd County doesn't care what Pulaski County does. They may be in the same district, but as a municipality, they don't care what their neighbor does.
Right. Whereas from a district standpoint, it would be simpler if I just knew, like, my whole district is doing it this way.
Right.
But again, this way transitions more work in that initial year than this. Another suggestion was, rather than using the 25% as a growth factor, using some higher rate. And talk to the Shade Act about, is that something maybe we could do as part of that gradual transition, And as part of the annual review, so, year one, you use 25%, year two, you increase that to 50%, year three, you go to 75%, year four, you go to 100%. And so if you do that, then, again, this is using FY18 data, so, it'll vary a little bit. So if you use FY18 data, you use 50% instead of 25, then you would have, a number of counties that would come in, and some of them are the ones we talked about, Page and Rappahannock, which were kind of close to that borderline of transitioning over, and were kind of outliers within their district. And then you get to 75%, and you get into Grayson County, which is out in southwest Virginia, 200%, Rockbridge, Scott County, so again, some southwest Virginia localities start to pull in. And then another suggestion that was brought up was, well, why not just count everyone that's done at least one design and count them within the average and do a map on that. And so this is that map. If you took every designer that did one, you use that average and basically did the same equation, but the P factor, the number of private sector providers, was everybody that did at least one, then that's the map you end up with. I'll say that's a pretty stark contrast. I mean, that's...
So you make more money if you don't do this one, right? The agency, they'll make more money if they go with the first one or the second, but definitely not this one.
So that's kind of immaterial. I mean,
What do you mean it's immaterial?
We're looking at the concept behind the bill is a gradual transition, so it's not a...
We're okay with that, but there seems to be, maybe it's just me, there seems to be almost like a hidden agenda that you're trying to preserve a certain percentage of applications. You know, I'm sure that's tied to your budget somewhere. I mean, are you really trying to figure out how many applications you need to pay your bills with each municipality?
No, so what we're trying to do is have a gradual transition to the private sector, so in those areas that, right now are, fully supported, that moves forward, and then find a way to gradually transition those services into areas that don't currently have a lot of private sector
So
services.
which are the areas that don't support it?
So
Are
the
are
areas-
those all the red areas?
Yes, so I mean, the red areas are...
So those are the municipalities that voice opposition, that we can't afford this, we can't do it, we have to stay, VDH has to stay in business.
No, this is based on just looking at the numbers of bare application designs that have come in, the number of private sector designs, the number of private sector designers that are working in an area. I mean, it's reality. There's areas of the state that don't have a lot of private sector designers compared to, Northern Virginia and out in the Tidewater region
So
around.
the map's just really showing, people have put on different options of how to define the hardship, and the map's just showing what that would look like if that was what was adopted. That's all it really is, right?
Right.
Yeah.
Well, I guess what I'm hearing here is, have you actually talked to those counties as to whether they want to participate in that way?
So, I mean, we have gone and talked with Eastern Shore localities. We've gone out to Southwest Virginia. We're going around the state, and, there's open public meetings. But the intent of the bill is to have a gradual transition to private sector services statewide, again, with VDH as a provider of last resort in situations where the services aren't available.
Right.
Well, it's not about helping the localities, you're trying to help the residents that live in those localities, whether they have access to services or not. It's not a matter of make the locality benefiting from this, it's the residents that live in the locality. Do they have access to a service provider?
Well, you got Page County there in one map, which is up near Warren County, which is also included. There's probably 13 to 15 OSCs up there. And to say they're not served by that community is nonsense.
And so that's where the suggestion about...
Not to mention the wealth in those counties.
And so that's where the suggestion of doing it on a district basis rather than a locality basis came
Yeah.
out of. You just looking at the equation, it's part of it's volume, just the volume of applications. And so there was a suggestion, look at it on a district level, and then if you do that, it filters Page County, ties in with the rest of the district. But on a whole, on a statewide basis, if you do a district basis versus a locality, you actually transition more work in that first year with the locality-based map.
It just seems like you've got a cure in search of a problem here.
Hey Lance, does this data include what would currently be considered maintenance, since this was pulled in 2018? So D-box, voluntary upgrades, that sort of thing?
Right.
So this number could drastically decrease in terms of the application number.
That's a good point, because our repair permits have dropped significantly, so, and those have historically been better applications.
Well, I got another question for you on the formula. You're saying that you have that growth factor. What's the other factor that it multiplies by, the average? What did you call that? Do you have that formula?
Yeah, you can pull that up now. It's the, big Okay, yeah, I'm sorry.
Yeah, I think it's A, the average number of evaluations. Couple of things about that. Does that include engineers?
Yes, so all of this includes OSEs and PEs.
Okay,
So regardless of whether it's one license or the other.
so the average of OSCs and PEs.
Correct.
Okay, because the average for OSCs is going to be closer to 80 or something, didn't you say? 79 or?
Well, so again, part of it is the variation just in the OSEs. I mean, if you look at the top 30, their average is 141. You look at the bottom 150, their average is 5.
Right.
So, I mean, there's a lot of disparity just within.
Well, but some of that could come from the fact that some of those counties are closed counties at the moment. They haven't really opened up their, they're still performing 90% of the services.
And so are you suggesting that we shouldn't include OS or PEs in this?
I'm not really sure, but I think what I'm seeing is that when I saw an example of the formula used, it was 36 or 40 was the number you used, something like that. And it seems like on average, people could do twice that easily.
And so I had a conversation with someone yesterday. They suggested rather than the average, use the median. And would the median be a higher number?
There you go. That might work. It's just that at 30 some and say 1,200, I mean, that's not much of a business there. As far as,
What was that?
I said, that's not much of a business.
What wasn't?
If you take 1,200 times 30 applications, what's that give you, $36,000,
You live in large.
I guess,
You do it
if
in
you're in
one.
Tazewell County.
So just in terms of what's being shown on the map, I mean, so the averages are for what's considered the eastern part in that regional map. Average was 42 for OSC or PE. For the kind of north central part that goes from Rappahannock over into central Shenandoah and Florida Fairfax, average was 54.64. For the southwest region was 45, and then the central region was 55.48. So between 42 and 55 was the average usage. But again, median,
I think it'd be higher, wouldn't it?
and we can look at that.
Yeah.
Median
Okay.
would be higher. So one last thing that I do want to talk about, I did want to run through that, kind of those changes, is fees. So I've been trying to talk about this whenever we talk about the transition of services. So we do have within the budget amendment, there was a budget amendment that gives VDH authority to charge fees for repairs and voluntary upgrades. It's set at essentially the same cost for repairs as what you would have for new construction, so $425 for their applications, $225 for work with private sector designs. And again, the fee is waived for 200% or below of federal poverty guidelines. And then with voluntary upgrades, there's no bare application fee in the budget amendment because that's since transition to the private sector, so BGH doesn't provide those services. And then with SAPs, and again, this is strictly looking at 165 of the code, 13.165. You have $150 if it's a bare application, BGH doing that evaluation, and $100 if it's private sector. And with private sector there, you look at that section of the code, it's an expanded list. It's not OSCs and PEs, it's OSCs, PEs, installers, and then you also have the operators, and then there's an NSF certification.
Right. So how are customers, individuals going to know that there can be a fee waived with being below that 200%? I mean, is that something
So,
advertised? I mean, it's not like
Yeah,
we're just
so-
going to say, oh, by the way,
so like I recall when we had the fee increases in 08 or 09, I can't remember exactly when it was, we had that fee increase. Looking at something similar where there's some information that can be posted in the front counter in the local departments, looking to try and get that out pretty early on in the new year, so it's not, there's some advanced posting of that,
maybe like
putting
the
information on the website.
installers or their, putting that out there as well for their customers.
Right.
That
And making sure-
material made available for them to have.
Right, making sure that the private sector is aware of that change.
You know, Lance, I'm just going to pick a bone with you on this one. How long ago was it Governor McAuliffe tried to expand Medicaid or Medicare in Virginia? And we almost had a shutdown because we were going to expand Medicaid, Obamacare. And what was the threshold over the poverty guideline?
138%.
138%. And yet, here we are with this plan where we're talking 200% and 300% and 400%. I just don't get it. You know, just don't get it. I appreciate you understand that.
It was brought to my attention yesterday.
Okay,
So
good.
That's why
Thank,
I knew the number right off the top of my head.
thank you, Lance.
So again, the kind of close this up. So our goal is to put this draft guideline, take the comments that we got back, the SHADE Act. Again, the section dealing with availability and the 15 days, there was a lot of different ideas that were thrown out there during the SHADE Act meeting. So I anticipate getting some different options, and it may be that that's how we present the next draft rather than, here's the section. It might just be, here's the 3 or 4 options that have been thrown out or something like that. So people can comment on all of them rather than just the one that's in there.
That would be good. I
Um,
appreciate that.
Because there was a lot of different ideas thrown out at that meeting.
At the Shade Egg?
Yeah, for that availability, the 15-day part, there was some suggestions about increasing the days or having local health department review. I mean, like I said, there was a lot of different ideas.
Well, how'd they come up with that? I just curiosity. How'd they come up with the 5 as that minimum number of applications submitted?
Within the, looking at the, counting the AOC, so
Yeah.
where we were looking at that was, we said if a locality has less than 10 applications, it would transition. And so the most, if you have 11, the most anybody could do is 5 and 5. So just kind of looking at that way in order for you to be not an automatic transition out less than 10. The most you could have is 2 AOCs doing 5 designs each.
So if we had 10 AOCs doing 1 each,
And there was suggestions about, instead of doing 5, what if you look at 3 designs, or 2 designs again, 1 design, I mean, there's.
well, I'm looking at this trying to help you see it. It's another barrier to entry. You're in a business where it's 99% small business. There aren't a large number of large design firms that have numerous employees. So as you have staff that ebb and flow out of each district, and then someone wants to hang a shingle out, it creates a difficulty in them. Suppose they want to move to Southwest and start that business. It's not going to happen. So for you to sit here and say, we're going to choose a 5, it just seems to be an arbitrary number that's going to be another barrier for someone trying to start a business that in the end helps everybody.
And again, so part of this is looking at the annual review, making sure we're moving in the right direction as far as transition and work to the private sector. So are there, even what we come up with as the final for this round, for the first year, maybe it needs to be modified in the next year to help more work be transitioned and so on and so forth for that transition for 4 or 5 years. So.
Sure.
Your federal poverty guidelines that you have up, you had dates on there. I know in the draft there aren't dates on there. Is there a reason for that? Is it going to change every year with the federal? I mean, it changes every year with the federal, or so many years.
Right. So with the means testing, the first year it's 400% or below. So that first column in here, I think it's the last column. Correct.
Yes.
So is there? You think the one that we have in the slide would be more helpful?
No, I was just curious.
You know what I
So,
mean?
like, then, starting July 1st in 2020, are we taking away the 400%? Is that what we're basically coming down to?
Yes.
And then in 2021, we're going to go 300%? So you're just working it way down to 100%? Okay.
And so that gets back to our earlier comment. We don't necessarily have to mention the 300, 200, 100% if we're going to revisit it next year.
Okay.
But it's kind of laying out, this is
So we're just
as
getting
much of a plan as you can.
started.
But you're right, we would go back next year. That would be one of the edits. We would go in and take off that 400% column.
All right, so that makes more sense.
Yeah, but you don't ever go down to 100%, do you?
So,
It's going to stop at 200%.
No, 100% is 20.
so with what we've proposed, it would be 200% for repairs and 100% for.
New construction. Okay.
Let's look quicker for it.
Well, I just don't quite grasp the philosophy here when couched with public health goals. Why, given the opportunity to free yourselves of essentially a burden, why are you still trying to cling on to it?
And And again, I think it's a difference of opinion. We're not trying to cling on to it. We're trying to have a gradual transition of services to the private sector.
Right.
And not be a flip the switch, it goes private, July 1st.
Well, you have that with the income, the means testing. I see that. That's fun. It gradually tapers out. But these other things about whether you do 5 applications in a county and all this kind of stuff, turnaround time. Why is turnaround time more important than, I mean, this sounds like a business concerned about getting your dinner order out in a timely fashion. This isn't a public health outcome, in my mind.
It sounds like it's based on the codified timeframes for the health department.
And it does sound like it's based on those too. And I just don't get the purpose of that. I mean, I think public health is a very important thing, particularly coming here into the future, where you're going to be needed for so many other things besides cranking out another real estate construction permit. It just boggles my mind that that's where the emphasis is.
And again, that's part of this annual review process. You know, if we come back next year and we're not moving in the right direction, then, you know.
Well, we'll be here to tell you that.
Right, you know, which hardships are people applying for, which ones, you know. Part of it is, you know, we just don't know how many people are gonna apply. I mean, there could be owners that look at the petition and they just don't wanna bother with it. And they just go to the private sector, even though they might qualify for the means testing or hardship. So part of it is, you know, we haven't done this before.
Well, I mean, Lance, if your numbers are correct and the volume of subdivisions that you've been receiving the past couple of years, I don't think Virginia has a growth problem to have to worry about. I mean, in the next 2 decades, if those numbers are correct.
So, so we didn't incorporate subdivision information into that.
Well, no, I get that, but what I'm saying is, you know, for your future demand of services, there's not a lot of lots being created. The lots that we see being created are all on public water sewer. You're never going to see that. So, I mean, that's one less thing you're going to be needed for, but in the rural areas of the state, we don't see a lot of new growth.
And, you know, our application numbers have been continuing to go up since, you know, we bottomed out 08, 09. We're certainly not doing the 40,000 applications that we did in
2007 or 2006?
4, 5, 6,
Six.
somewhere in
Yeah.
there.
And Lance, what about, and I don't know if it's really relevant, but maybe those jurisdictions that decide, is there that possibility that a jurisdiction or a health district might decide we're not going to provide the service period?
Right. So that's an important distinction. So there's a may in the hardship guidelines, and the intent of that may is for Chesapeake County. They said we don't do new construction services. They transitioned that several years ago. The intent of that may was to say for those localities that have already said you've got to go private, you know, the hardship wouldn't apply there.
So that's a safe position. So if a health district were to say, we decided to our health district, we're not going to provide services for new construction, we're not going to be forced by mediation to say you have to provide that service because the health department has established these guidelines.
Again, the idea being those localities that have already transitioned would remain so.
You had a slide up there about further considerations with the case-by-case decision, I guess, by the district health manager. Is that strictly how it reads? I mean, if a person petitions the district, they can basically waive all these hardship guidelines, or is that not the intent of it?
So it would be similar to like a variance request where you have to show what is the, public health.
So it's the discretion of the manager to say you grant that variance request or deny it.
And what we've said in the, you know, the management meeting, you'd be very judicious with those requests.
Like, so there's a reporting element to that, so, you know, it's not like they just do it in the secrecy of their own, area. You're gonna wanna know in your reporting document that how many of these you did, what were the reason behind that.
Right.
You would assess that, each would assess that at some point.
But because if we have something that's coming up as, you know, it's being requested as a hardship over and over and over again, and it's getting denied over and over and over again, then maybe that's an exemption we need to spell out in the hardship.
You know, there's a 40-year-old pump station that's finally deteriorated with mud and water pouring through it. It's no fault of anybody's, but to charge them repair cost and the private sector for you to do that, you know, that seems like that would be something that you could apply for. That wouldn't cost anything really.
And so and I guess that gets to a different question with fees. So pumps, replacing the pump.
I mean, the whole station.
The whole station tank, yeah.
Yeah, so we're on a repair, not a maintenance thing.
Yeah, so in that case, you know, that would be maybe where somebody submits, but again, it's
A reasonable request is what I'm trying to make an example of.
ultimately, we're gonna need to see what requests are coming in, and we're gonna wanna make sure that we're being consistent.
Sure.
We definitely wanna be consistent within the districts of which ones are being denied.
Right, so requesting to build a brand new house, just, that would be denied, yes, that would be something that wouldn't be, yeah, that would be, follow the rules on that, yeah.
And the reason why we're recommending that be to the district health director is, you know, if all those requests become to the central office, then that potentially will slow that down considerably.
Will a means approved permit transfer to another owner?
So that's a good question. I think because of the way that the language is set up where a permit can transfer without any update, I would think if the original person that applied means tested and then they sold
You
it,
don't-
they've already got the permit. So
You
I
don't
think-
see a problem with that?
I don't think they have to sell it, Lance. I mean, it's not difficult if you just want to get around your regs to have any poor person make the application.
Well, I think that with looking at, income, it's not just the person that owns it, you're looking at everyone that's living there at the time, based on my experience. Because I used to do the income verification for the health department, and it is based, not just on one person that owns it, it's based on everyone that's living there at the time.
So Jim, Bob, so if I understand your concern, you're worried people will work the system, get someone that's below the income level to apply, and then as soon as it's done, they'll transfer it to the.
Yeah, a lot of real estate is
But,
speculative.
I mean, that's what I'll do. Why pay someone to do it if I don't have to? And you won't be able to stop it in contract.
Would it have to be a loan?
Well, you know,
Would it have to be a loan?
Yes.
you'll get the permit issued in the contract purchaser's name. As soon as you have the permit, it'll be transferred.
So within our regulations, what we talk about ownership is owner or future owner. So you might have somebody that's applying that's in the process of
Wow.
purchasing.
Who'd have thunk it?
And I'm sorry, I'm taking it.
No, that's all right.
No, it's related, it's the same question.
Is it protected? Like with the, I mean, people that, it becomes then, if you think about it, if they're providing their income information, then all of a sudden you're dealing with a lot of protected information. Their social security numbers, you're looking at W-2s that have a lot of information that is not public knowledge. So if you have somebody that comes in and is applying for this, going through the petition process and listing all that, that can't be viewed. That needs to be somewhere else that has to be private, like the medical stuff that comes in that's HIPAA required. And so then if you have a new owner coming in, they're not allowed to see that. And I don't know, are they allowed to know that?
Well, so,
How is that done?
But I think that's what departments are already an issue.
Right, but then can't,
that's a good point though.
how are they gonna look though and see, well, how do they qualify? Well, they
just-
didn't make enough money, you know, I mean, that's private information.
It is just checking the means tested box, even though you don't put down your income there.
Right.
It's just checking that box.
Yeah, it's protected, so I mean, that's something that's gonna have to be looked at, and who's looking at it. It shouldn't be available, it should be looked at by the next person.
And that would be a problem, because that application is available to the public.
Give them a
Right.
couple files, they should do it.
You have to redact
Yeah.
those applications.
Yeah. Where's that information going? We go out and look at things like that.
What happens if I want to qualify for like a health program, like women, infants and children or something? How would I go through the application process for that? What do I have to do?
And
WIC program, I can tell this, I used to work for WIC. So when somebody comes in, they're bringing all of their information. We're verifying that information.
Right,
We are not copying that information. We're verifying that information.
right. So again, why do we put ourselves into this place?
Medical will copy it. Medical side copies it because it's put into a HIPAA folder that nobody can see. So that part of it, yes, is copied, and that's verified.
Are they concerned about the HIPAA, or are they concerned about defrauding the government?
It was all HIPAA medical.
I just think you're embarking on a whole course of action here that just balloons whatever is going on. And there's a lot of loopholes.
Shh, can't hear. Oh, God. Lance, get some order in here.
I'm sorry?
We can't hear, there's too much.
So I'm
You're done.
going through my presentation. Are there any
And
other?
also the state has granted certain people, only certain people within the department can look into and verify through the federal verification of what that person's income was. Like, they can go into the IRS and look at the GW2. They can look at what the gross income was with their taxes. So there is, verification from that, but only certain people are granted that through the health department.
And if someone is in debt set off from the Commonwealth, how would that work?
If they're
Debt set off. If they owe taxes or personal property taxes, or they're behind, or they have a lien, or how would that work?
I'm on.
As far as longevity and meeting those requirements.
That's what I have written, and there's folks go on the town hall website, submit comments there. And again, we're looking at a second draft early part of January, and probably do a webinar or something so we can get kind of broader participation. I prefer face-to-face to these kind of meetings, but it's also tough, especially that time of year, for us to get out and cover a large part of the state. So I'll probably try and do some kind of a webinar or something to kind of go over what changes were made from the first version and give folks an opportunity to comment. And so if you have any suggested edits to the guidelines, changes,
Ed, could you summarize maybe what you're planning for the second draft? What changes you're,
So, part of it is I'm waiting to hear back from some of the Shade Act members of, what their suggestions were on like that availability section. Again, at this point, I think just because there's been a lot of suggestions on that, it might be best to have option 1, option 2, option 3, rather than just saying, here's the one that we're thinking about.
like a drop-down list?
Yeah, so that people can comment on the various options. rather than-
Lance, has the Shade Act had a full roster?
So,
I mean, I guess what I'm questioning is, who are at the table, who's sitting at the table making the suggestions?
so the last meeting, we did have a quorum, the meeting before that, we did not.
Well, I didn't ask to get a quorum. I asked, are all the state-appointed factions, are they at the table?
So we're actually in the process of getting ready to follow back up with all of the groups to try and make sure that we've got full participation on that.
Because if they're not showing up, and there's some repeat offenders there, that I don't think they've shown up for years, get the commissioner to either force them to show up or kick them off. I mean, if you go back and look through your notes, there are plenty of repeat offenders. The program affects everyone. They were appointed there for a reason. If they don't show up, they're hurting everybody.
Hey, Lance, is there a process for someone to appeal if, let's say, they're denied?
And so that is one thing that I'm looking into, is like also the.
Yeah, like we deny somebody and they don't agree with us, is there an appeal process for that? But it goes back to the whole timing thing too, because that has time to
Application was denied.
if they were appealed.
And so that is one thing that we need to add into the guidelines to talk about. So that would be another thing that would be added in, again, the availability. Also looking at maybe putting in there, suggesting that the factor would change over time. Kind of like with the income eligibility, you don't necessarily need it in there until the next revision, but if you kind of lay out there at least what we're thinking, that it would go from 25 to 50 to 75 to 100, so that it's laid out there in the policy, rather than waiting until next year to send it in.
Yeah, how do you feel about that idea?
I mean, I threw that out to the Shade Act. They seemed to think that was a good idea, so we'll put it out there and see what feedback we get.
And you, on your slide, you had the timelines, the guidelines of the days as far as, and you're not sure what the clear definition is going to be, and it's pretty broad.
So the availability piece, the intent of what we had was making that initial site visit, and that the property is, prepared, to be visited. So we are looking at putting some clarification in there. But then there was, seriously, there's been a lot of different opinions on that section, a lot of different suggestions, and so we're trying to get, kind of putting out there for broader input, what's been suggested, and get feedback on all of it, rather than just putting forward one option, which we had in the first draft. That's why it's the first draft. Thank you all. Thank you again, Patrick, for setting this meeting up. I really appreciate it. And the rule act, the meeting minutes, and the PowerPoint will be posted on Town Hall. So that will be available.
Thank you, Lance.
Thanks, Lance. You did a great job. Hey, Lance, do you have a minute?
So then when I was coming, it was back.